Yeah. We have newborn and we did a Quizlet. But there is a game on Quizlet called Blast. So hold on. Is my screen showing? No, it's still loading.
It still says broadcast something.
Okay, it's loading. Hold on. Wait, how do we do this? Why isn't it letting me share my screen? Hold on. Hmm. I click share screen and it just tells me screen broadcast.
All right, you should just click share,
Yeah.
click the green button share, and then
Mm-hmm.
a little window should pop up.
Yeah, it says screen, photo, share camera, iCloud Drive, website URL, or whiteboard.
Yeah, so you have to have your Quizlet open.
I do.
All right, share your screen with me if you can.
Yeah, I'm trying. It's not letting me. It just says share screen, unless one of you guys in the group know how to do it.
Just click on the first box where it's saying share entire screen.
I am. It says screen broadcast. Start broadcast. I'll take a screenshot and show you.
Yeah, I saw it just said that. It showed us that. Um, hey, why is nothing working tonight? Do you know one of those
I don't
days where you're
know.
just like, enough?
Yeah, I don't know.
All right, send the Quizlet to me and I'll try to
Okay.
share it for
Or
you.
maybe somebody else in my group can try. I don't know. But
Does someone else in your group have the Quizlet?
yeah, we all have it.
Awesome. Somebody else in that group try to share it, please.
Are you able to?
I don't know who
I
else
don't
is
know.
in your group. Who's in
Yeah,
your
I see them. They're doing it.
Okay.
Okay, they're trying. Hold on.
Okay. Desiree, you're in that group.
Oh,
Can you share your?
yeah. Her and Andrea are trying right now. That's so weird.
You should be able to just click share, and then it gives you different windows, but you have to have the Quizlet open.
Yeah, that I do though. That's the
Yeah, that's
thing.
the thing. Like I have it open, but when I click share, it doesn't.
It also says screen photos,
Yeah,
blah
like it
blah blah
doesn't
blah.
just say share screen. Like it's
Okay, so when you click on share, okay, then you should have different application windows, correct? This
Yes.
entire screen, application windows, and then you see the windows below.
No, I'm gonna show you what I see when I click share.
Okay, just send me the Quizlet.
Yeah. Oh, Shanae did
Oh,
it.
I
she
think
got
I
it.
let
Oh, thank
Thank
me.
you,
goodness.
Shanae.
Mhm.
Woo!
Okay, so you can click blast, Shanae, in the second row, the middle one. And so this is the game. So essentially, it's gonna put a question at the top. I'll read the question, and then there's gonna be little bubbles floating around, and you have to click the correct answer so that it shoots it out. So we'll read the question, and then somebody has to say which one of those little bubbles is the answer. Yes?
Okay.
Okay, so somebody in the class has to answer, not your teammate. Go.
Do you
Go
guys
ahead,
just
press.
see that one, right?
Huh?
You guys just see that one? Because I don't know.
Yeah. Yeah,
Okay.
you're good. Go ahead and press play.
Get ready.
And it's timed, by the way. Okay, what blood glucose level is considered hypoglycemia in a newborn? And so you see the little floating bubbles. You guys have to say which one it is.
All
And
right,
it's timed.
Less than 40?
Okay, Shanae, click that one. Yeah, that's correct. So
Good. Less than 40. That has to be the answer because look at all their other answers. Good. So blood sugar less than 40 is going to be a hypoglycemic. Oh, we're on to our next one. Go.
Yeah, it goes fast. What is the priority intervention for a newborn with hypothermia?
Skin to skin.
Okay.
I want to talk to you
Good.
guys about hypothermia for 1 second.
Okay, go ahead.
So hypothermia, we did not cover cold stress in our lecture, and I just want to touch on that really quick. What's the first thing you do when a baby's born?
Skin to skin.
Skin to skin.
Skin to skin or?
Dry them off.
Yeah, you got to dry them off. So as soon as that blanket gets wet, you pull that blanket away. Dry them off again with a dry blanket, right? So we have to make sure that we're always drying off, right?
Right, and you keep the skin warm. You got to keep them warm.
Yeah. Yep. If you don't keep them warm, they're going to have respiratory alkalosis and acidosis and metabolic. So be really careful with that. Okay, let's play again.
Okay, go ahead. Play again at the bottom. Okay, what is the normal temperature range for a newborn?
The 97.7 to 99.5.
Mm-hmm. What is Erb's palsy caused by?
Delayed absorption of lung fluid.
Okay. So that was wrong. Go ahead and try again.
Brachial plexus
I'm
nerve.
sorry.
Good.
Yes.
Yeah, brachial plexus nerve. What medication is given at birth to prevent hemorrhage?
Vitamin K.
Vitamin K.
Yeah. What is the normal respiratory rate for a newborn?
30 to 60 breaths per minute.
What is the priority? Oh, we just did this one.
That's okay. Do it again. It's
So-
very important.
What is the priority? Oh, well, intervention for hypothermia? Well, skin to skin, yeah.
Do you want to try the matching or no? I don't know if that's...
We can try. That one's kind of complicated, though.
All right,
No.
let's do the flashcards.
Flashcards? Okay.
Yeah. We did this one.
We did this one. Yeah, go next.
Go to the next one.
We can do that one. That one. What does acrocyanosis in a newborn indicate?
Blue extremities.
Yeah, what does it indicate?
Decreased oxygenation. No, it's not. That's a normal finding.
Mm-hmm. Very good. It's a normal finding. So if you see that, do not get stuck on that with a question. That is a normal finding. You're going to see blue hands and feet. It's just that their circulation hasn't, like, they're not ready to go yet.
Again.
This one we talked about cold stress and blankets.
Yeah.
What's some signs of respiratory distress? This is a very good question.
In a newborn.
The breathing, the flaring of the nostrils.
That's one. Good.
Grunting.
Excellent.
Mm-hmm. Oh, go back. You can flip it over, Shanae. Yeah. So, yeah.
All right. Remember
Here's the
all these
thing.
things. So you're going to have quick breathing. It's going to be hard to breathe. You're going to see their ribs. And because they're babies, it's very clear to see those ribs like pulling in, retracting in. Okay, go ahead. Next question.
What is the primary cause of physiologic jaundice?
What do you guys think the cause of jaundice is?
Isn't it a deficiency of, isn't it a vitamin?
No. Not a vitamin.
Low bilirubin?
So, yeah, kind of. So, it's immature
Good.
liver unable
Yeah.
to process the bilirubin efficiently.
Yeah, and how common do you think that is?
I feel like
I think it's very common. I've seen a lot of babies with jaundice.
Yeah, it's not that uncommon. It's kind of commonish. So what's our treatment?
Light therapy.
Yeah, we put phototherapy, but yeah, same thing.
Good. And what I want you to know about jaundice, if you forget, is it's called putting him under the cooker. That's what we call it in the NICU, right? We put him under the baker. It bakes all that stuff off, okay? So it's lights, and what do they do to the eyes? They cover the eyes because the lights are no good for the eyes, right? And they're gonna have all these lights on them, and it's to get rid of the bilirubin. Okay, so if you're ever thinking about jaundice, what happens? I like to think of jelly and heating it up because that's a food and that's what happens. You put it under phototherapy. Okay, just like a trick to remember. Good, excellent. Go ahead.
What is meconium aspiration syndrome? So what does that mean?
It's where they aspirate their feces.
Yeah, so an inhalation of meconium causing airway obstruction and respiratory distress. And so what would be the priority action for a newborn born through meconium stained fluid?
Wouldn't they have to suction first and then they have to get it out of the lungs?
Yeah, so you can flip it over. It says assess the airway and the respirations immediately. So yeah, check their airway
Okay,
and
and
then get
so
rid of it.
yeah, excellent. You're gonna assess airway and respirations. But remember, meconium, if they suck it in, it's gonna go down to the lungs. So has anybody seen in the nursery how do they get that stuff out?
No, I haven't
Or
seen
in
that.
labor and delivery. They use suction. Just
They
like
that's what I was gonna
milk.
say. The suction, and they just keep
It's
going
a
down in
long skinny tube. Stick it down the nose,
tube. Yeah.
go down. And what you do is you don't constantly suction like on an adult, but you can intermittently suction. So you take a little bit out and try to get it out. Sometimes it doesn't work, but you do your best to try to get it out. Good.
Yeah. We have
What
an
happens
ad
if it doesn't work?
information.
Well, then they try to get them to get rid of the meconium in the lungs in a different way. So what they will do is they will monitor definitely closely and see how much they can get out. They're not really going to do anything necessarily for about 24 hours. You're going to see if that baby's having trouble breathing within the first 4 hours about. So they'll watch for that. Now, meconium, I mean, if you have meconium in the lungs, what do you think you're going to do about it? You got poop in their lungs. What are you going to do?
Well, can't that set up an infection as well, though?
Of course, they can get sepsis from that, right? Because it's like dirty stuff. But so they monitor it really closely and then treat it based on what is those babies that like have meconium stuck in there, they struggle quite a bit initially. Because that's everything, they're not breathing, everything slowed down, they're high rate for infection, that kind of stuff. All righty, APGAR score, go.
What is it used for, and like how many minutes after birth is it done?
It's used for the I don't know how to explain it, but it's used for the baby, and it's used at I think it's like the first 5 minutes, and then
Yeah,
again at
so
10 minutes.
yeah, so it's like an assessment of the newborn, and then for the first ones, it's 1 minute and then 5 minutes after birth.
And sometimes they'll do a 10-minute if the 1 and the 5 are yucky. So if they want to like see, like, so if a baby's really struggling and they have like a 2 of an APGAR and then a 5 of an APGAR, sometimes they'll do a 10-minute because that like will give them a higher APGAR. Why do you think it matters what their APGAR score is?
Because that would be the healthier the baby.
Yeah, so those ones with lower APGAR scores, it's very interesting what you'll find. APGAR scores, oftentimes you'll see ones that are low. The kids will have developmental delays. So if you do anything in school nursing, a lot of when we do IEPs, we always ask, was that baby in the NICU? We don't ask what were the APGAR scores, but usually a parent will say they had very low APGAR scores. So they see a correlation with low APGAR scores and some developmental. Not always. Some babies, doesn't matter, but some babies it does. So, just an interesting piece of information. All right, go. APGAR score, go ahead.
What does an APGAR score of 4 indicate, or what can it indicate?
All right, so APGAR score, you're checking heart rate, you're checking skin color, respiratory rate, is it moving? And what about if its extremities are blue?
Yeah, and the final number or the highest score is 10. So if it's a 4, what could that indicate?
It could indicate a lot of stuff, but I mean, she just said most of the stuff. I would say that most of it will probably indicate a low respiration.
Yeah,
could indicate that the
that's
baby
exactly
is
the answer.
not alert well enough.
Yeah, so severe distress that can require immediate resuscitation.
All right, so if you got an APGAR score, that means you're barely breathing, barely have a heart rate, you're blue, and maybe you're not moving, you're just laying there. The baby's just laying there. That's
Yeah.
laying there for a low APGAR.
Okay, what is neonatal abstinence syndrome?
Kelly is doing very well in answering all the questions. Somebody help her out. Somebody else answer. Think about it. Abstinence. Where do we see abstinence? What should we be
Mother was on
thinking?
drugs, and now the baby is born, and now they're going through withdrawal.
Excellent.
Yeah, withdrawal symptoms in newborns exposed to drugs in utero.
All right, and we watched that video where they shake. Oh, I won't say anything.
What are symptoms of neonatal abstinence syndrome?
Shaky. I think crying a lot. Maybe a fever.
No, they're gonna be like this. They're not gonna know what to do. If you've ever watched anybody withdraw from addiction, they're gonna have the same kind of behaviors. They're gonna be really irritable. Even if you've seen someone who stopped smoking, it's like the same kind of thing, or somebody who stopped drinking, right? They like get irritable. They're really like, people make them angry. They kind of shake. I mean, you see that with alcoholism. They'll shake when they don't have a drink. Seizures can always happen with any withdrawal. So babies or full people. So some of this stuff you see happens in adults and happens in babies both.
Yes. So what is herb palsy caused
Can
by?
it cause a distress?
No, it's okay.
I'm
Go
sorry.
ahead.
Can it cause a distress in the airway too, like respiratory distress?
I mean, I guess so. Nothing's really working right when they're withdrawing, right? Remember, their bodies are so little and they're going through withdrawal. So there's a medication we give to them. Anybody know what it is? And I think, Kelly, you're getting to this by the medication that we treat them with. What do we give to the kids that are going through withdrawal?
Is it Narcan?
Mm-mm. Nobody knows? These babies get morphine.
Oh,
The
right.
morphine
to calm them?
Yes, to calm them and to help with the seizure activity. And so if they have morphine, what's going to be slower?
The respiratory system.
Exactly. So I think that's where you're going with that one. So yeah,
Right.
it can, but so what happens is these babies are on drugs, they withdraw, then they're given big drugs, and then the poor babies, they're like a mess. Anyway, go ahead.
What is herb palsy caused by?
Number palsy. So it's not something's not working right.
This was actually one of the last
Yeah, we did this
questions. It
already.
was just wrong. Yeah. And then someone answered it right.
Right? It's nerve injury. So
Yeah,
something
brachial
happened.
plexus.
Good.
What is a treatment for herb palsy?
What do you think? From shoulder dystocia. What's some treatments going to be? All right, group, instruct us. What are some treatments?
One thing is going to be for pain, right? To treat the pain.
No, that's not usually very painful. The actual
So
palsy, the shoulder dystocia, if they break the
yeah,
clavicle, right? But what
we
you
just
got to
put
do with them
physical
is you got to get it
therapy.
working again, right? It's when they're like this. So you got to get it working. So you're going to do physical therapy, you're going to make sure it's positioned correctly. Good. Keep going.
What is the most common cause of newborn infection? This also kind of has to do with the mom. I like a hint.
Would that be the mom having an STD?
So it's a group B test that the mom gets at the end. That if she comes out positive, they have to give her antibiotics. But sometimes I think it goes like undiagnosed. Okay, what medication is given?
I think we did that one.
We did? Oh yeah, we did. We did. What is a it's okay, I'll still read it. What is a normal finding in the newborn's lungs immediately after birth? A normal finding.
This is a good question.
There you
So
go.
it's normal to hear a little bit of crackles because they still have
Yeah,
things in their lungs.
correct. Okay, what is transient tachypnea of the newborn?
Ooh. Transient. So does that mean it stays or it goes? If it's transient.
It goes.
Yeah.
So would that be
What's tachypnea? You guys should know this from MedSurg. Come on, are you guys
Rapid
sleeping?
breathing. Rapid breathing.
Are you guys sleeping? I feel like you guys are sleeping. These are really good questions. This is a great HESI review. Keep going.
So the answer, yeah, delayed absorption of lung fluid, which causes rapid breathing. Like, what intervention prevents heat loss in a newborn? I think we did this. Oh no, we didn't. Oh yeah, we did. What
No, we just
intervention
talked about
prevents?
you got to change the towels, right?
Yeah, the towels
The blankets, whatever.
and skin to skin.
Okay.
What is the normal time frame for passing meconium?
isn't it within 24 to 48 hours?
Yeah. Yes, good. What is a key sign of neonatal sepsis?
Silence. Nobody knows. All
I
right,
feel
go
like I'm
for it.
answering them
Okay.
all.
Karina. You
Yeah,
are,
I know you
Kelly,
are.
but
It's
at least
okay.
it's a
Thank
good
you,
review
Kelly.
for you. If everyone else is sleeping, that's on them.
Yeah. So it's temperature, instability, poor feeding, lethargy, respiratory distress.
All right, all the bad
And
stuff.
then last question, what is the priority intervention for a newborn with apnea?
Wouldn't that to be apply oxygen immediately?
Yeah. So gentle stimulation, oxygen, or a bag mask if needed. So yes.
So sometimes, just as a reminder here, sometimes the babies will forget to breathe. So all you really have to do is stimulate them and
Just
they'll
wake
breathe
them up.
again.
And how you stimulate them, wouldn't that be to like stimulate by the foot first? The
Yeah,
bottom of
you
the
just
foot?
like you don't hurt them. You just do something like tickle their
Yeah,
feet.
that's what I'm talking about. Like just rub the bottom
Yeah,
of their
rubbing
foot.
their feet, rubbing their back, their arm. I mean, they'll wake up, if they're not sick, they'll wake up. You just need a little bit. You don't need to be like, hey, wake up, They wake up quick. Anybody who has a baby knows they wake up. Right quick. Excellent work there. All right, that was newborn coverage. Anything we should go over that we didn't go over? No? All right, moving on out. Keep going. Group number 2. You guys were like labor and something and something.
No, we were postpartum.
Oh, you were actually group 3, weren't you? You were in room 2, but group 3. Okay.
Oh, okay.
Postpartum, here we go. Go for it. Good, it's cute. So we should be loading. You guys should be, okay, you're going to be playing. So do classic mode, right? And we're all playing. So everybody log on to Kahoot, please. Go ahead, you got to start the game to give them the log on, Kelly. No, just click start. Huh? All right, here comes the pin. Everybody join. Okay, Kelly, do not start until we have 14 people, or no, not 14. 12 people on here.
Okay, it's Keyshawn. It's under Keyshawn. Keyshawn's doing it.
Keyshawn, okay. Make sure everybody joins. All right, go for it. You can start. All right, you guys read the question, or you just want them to answer? You guys are hosting the game, so somebody's got to read the question.
I was gonna say I can read the question if need be. I can do it. Says the
Okay, go.
postpartum patient is experiencing severe headaches and vision changes. What complication is suspected?
Okay, the only possible one there, vision changes and headache, is the high blood pressure. Okay, so think about it. When you have high blood pressure, you're going to get headaches, you're going to have vision changes. Go ahead. Next.
What is a common cause of postpartum urinary retention? Increased mobility following birth, excessive oral fluid intake during labor, low blood pressure during labor, or perineal swelling or anesthesia effects.
Excellent. What do we have to do with our epidurals? What do we do prior to an epidural?
Clean the perineal.
A
Clean.
catheter.
No, we do that after the epidural. We don't torture
Oh,
them.
okay.
Empty the bladder.
No, you don't empty the bladder before an epidural. What do you do?
Make sure the area is clean.
Oh, no, that's not our job. That's anesthesia.
Oh, I'm thinking about the anesthesia job. My bad.
No, what do we as nurses have to do before they get an epidural?
Assess for respiratory distress.
You like that answer, I think. No,
I
we're
love
not.
it.
Why are we're not gonna have respiratory distress because we're getting an epidural? What do you have to do before you get it? Before an epidural?
Take vital signs.
Okay. What else? Come on, somebody help her out. Poor Kelly's got to do all the thinking for 14 people. What do you do before an epidural? What does an epidural cause? Let's do that. What does the epidural cause to the blood pressure? What happens to the blood pressure post-epidural?
It dropped.
It drops. So what do we do to prevent that drop?
Give them medication.
No. We give them fluids, right?
Oh,
We
yeah.
give them fluids. We open
That's
that
what.
IV line. Pshoop.
Yeah, and you give them
750 cc's or 500 cc's.
that's what I was gonna say. You got to give them 500 cc's before.
Yes, you open that
No,
fluid.
no,
So what is
no.
that going to do? Now they have all this fluid in them. They have a catheter, right?
Mm-hmm.
But if they can't take the catheter out, anybody who's ever taught anything or knows anything about med surg, that area is going to be very irritated. So it's not going to be easy to pee. So they're going to retain their fluids because they've gotten so much and they have no way to get rid of it. Okay, go. Sometimes they're numb. Sometimes they're swelling. There's so many things. Good. You guys got to use med surg on your HESI because it's going to come in play. Although it's OB, it's still med surg thinking. Okay, go.
Breastfeeding mothers should feed the newborn how often? Every 2 to 3 hours, only when the baby cries, every 4 to 6 hours, every hour on strict schedule.
Good. I'm glad everybody got that. If they were feeding every hour, nobody would breastfeed. Everybody would be so exhausted if you're feeding every single hour. When the baby cries, that's on demand. That's once they get a little older. Okay. So good. Keep going.
What is the priority assessment in the first hour postpartum? Uterine firmness and location, perineal edema, maternal temperature, infant bonding behavior.
All right, good. So whenever you get a question like this, bonding is always going to be important. It's never well, I shouldn't say never. It's not going to be the priority. You got to make sure this lady isn't bleeding out, right? So you check your uterus, say, is it firm? Is it below the umbilicus? Is it too below the umbilicus? You got to make sure that that uterus is going contracting and getting back to smaller size. They're going to have bleeding. So how do you know if they're bleeding too much or not enough? You got to watch that uterus assessment. Good.
What is the normal time frame for postpartum blues? First 24 hours postpartum, 3 to 6 weeks postpartum, 2 to 14 days postpartum, or 6 to 12 postpartum.
All right, we're gonna see, is that right? I don't know that's right.
The first 24 hours, I would think no.
I don't think so. So you're not gonna see postpartum blues yet, because they're just getting used to having a baby. Before discharge, they will do a depression screening. So usually discharge is 2 to 3 days following, or 3 to 4 days if it's a section. So I would guess the answer is 2 to 4, but this group is saying it's the first 24 hours. I don't think so.
Postpartum client has a long duration of lochia discharge. The nurse identifies the findings as consistent with inversion of the uterus, vaginal infection, pelvic hematoma, subinvolution of the uterus.
Good. And the inversion of the uterus, that would mean the uterus went upside down. Pelvic hematoma, they're going to have one. Hematoma is a big, like, bruise. It's not going to cause bleeding. It's just a big red bump full of fluid. And vaginal infection, that's not going to cause bleeding. It'll cause a fever. It'll cause lots of other things. Okay, go.
Which of the following medications will the nurse administer to help control postpartum bleeding? Terbutaline, Tirason, I don't know what that is. Methadone, oxytocin.
All right, so I want to correct this question. Which of the following are going to help control postpartum bleeding? There are two answers here. Methergin and what else?
Oxytocin.
Yep. Yep. Oxytocin is used to bring the contractions on and bring the contractions after, right? Contract that uterus. So there'd be two answers. Methergin is going to be with if you're bleeding a ton. And usually you'll give Methergin if the IV line has been stopped. So if you don't have any fluids running anymore and you just have like a hook on your arm, then they'll usually give you Methergin because it's IM, but oxytocin is usually IV. So it depends on when the bleeding happens.
The nurse is assessing a postpartum client. Which finding requires the nurse's immediate intervention? Temperature, elevated blood pressure, heart rate, pain level.
This is a good one. What are we going to worry about with a postpartum patient? All right, why are we worried about an elevated blood pressure?
Eclampsia.
No, that's beforehand.
Before.
It can be for hemorrhaging, loss of blood, too much
Seizures,
loss.
shock.
Yeah, seizure shock, that's more along the lines of where I'm thinking. When you lose blood, what happens to your blood pressure?
Drops.
Yeah, right? The more blood you lose, the lower the blood pressure. So I'm a little confused on this one, unless we're talking about will they seize, right? Because eclampsia is what occurs after. So I'm guessing that's where that question came from. Okay, go ahead.
A nurse caring for a postpartum client notes the fundus is boggy. What is the nurse's first action?
Oops.
That was a typo. Sorry, guys, but you definitely massaged the fundus. Let's go ahead and skip that one.
You always massage. If that's the question, that's the answer. What do you do to the uterus? Massage the uterus. That's always your answer. Go ahead, next one.
How long do non-dissolvable stitches stay in after a C-section? 1 to 5 days, 6 to 8 days, 5 to 10 days, 6 to 11 days.
Five to 10 days. So what'll happen is they'll have stitches and then they'll go back to the OB. The OB will take them out. Okay? All right, keep going.
After having a baby, where would be the most localized swelling? Feet, lips, head, arm.
Think about med surge. Where does the fluid go? Good. Your feet. That's where you're always going to have your swelling go when you have excess of fluid. Excellent. Keep going.
How long after giving a vaginal delivery should I wait to drive? 1 to 3 days, 3 to 5 days, 3 to 5 weeks, 1 to 2 weeks.
One to 2 weeks for vaginal delivery. Why is that? I would have picked the 3 to 5 days. Why is that?
They say because it needs healing. Like they need to heal. Like because if you use your abdominal muscles after the baby is born like that, it could cause hemorrhaging and other things along that line. So they want you to
I
wait
would
1 or
say
2
for a
weeks.
section you can't drive for like 2 to 4 weeks, but interesting fact. Okay.
What is an appropriate intervention for postpartum client experiencing sore breast or engorgement? Apply warm compress constantly, apply ice packs or cool compress, wear a tight restrictive bra, and massage breast vigorously.
Okay, you'd put warm because why? The real answer for engorgement is to breastfeed, but why would you put warm?
So it stimulates the milk ducts.
Okay, so same kind of thing. So you're going to be expressing your milk. Okay, good. Go.
Which of the following are common symptoms of a postpartum infection? Increased appetite and sweating, frequent urination and dry mouth, fever, chills, flu-like symptoms, and foul-smelling lochia, mild cramping, and light lochia rubra. I'm sorry.
Good. Anything with infection, you always look for fever, chills, that kind of stuff.
A postpartum client asks when she can become pregnant again after birth, which is the correct response. Immediately after the placenta is delivered, 6 months after delivery, 3 weeks after the birth, only after her first postpartum period. It was 3 weeks after the birth.
Oof. Could you imagine being 3 weeks postpartum and pregnant? Oh my.
It happens.
It happens.
Which birth control options are considered safe for breastfeeding client? Vaginal ring, copper IUD only, progestin only methods such
Progest.
as
Go ahead. Go ahead.
such as a mini pill, hormonal IUDs, implants, or depot, combined estrogen, progesterone pills.
All right. So, you want to see what is not going to cross over into the breast milk? A vaginal ring? That's not safe. Why?
I don't know that one.
Okay. All right, go.
Which foods or substances should a breastfeeding client limit or avoid? Leafy greens and yogurt, whole grain and poultry, alcohol, caffeine, and high mercury fish.
All right, we all knew that. No drinking, no caffeine. All right, very good. Excellent. That was postpartum, and now we have our last group. Go for it. Number one didn't even have a name. Did they? Oh, yay! Excellent. All right. Where's our next group?
Give me 1 second.
All right. Any questions about the HESI so far? No? Maybe? So.
The only question I have is it going to be like more med surge questions or more like
Well, so it's
maternal and newborn
all
questions?
of maternity, if you think about it, has its basis in med surge, right? Because every single thing we talked about, blood pressure, bleeding, all that, that's med surge, right? So nothing is different. Just because they're postpartum doesn't mean we do anything different when they're bleeding. Just because they had a baby doesn't mean the world stops. So that's what I want you guys to remember when you're taking the HESI. If it makes sense to you, like for first like another example, infection. What do we know? Anything is infected. What are we going to see? I don't care if it's a baby, a mother, a vagina, a uterus. I don't care. What are you going to see with an infection?
Fever.
The fever,
Fever, tachycardia. What else?
chills, blood pressure.
No, blood pressure's not going to be infection. But you're right about chills. Fever, chills. It's when you're sick, right?
Right.
What do you feel like when you have the flu? That's infection. It could be viral, could be bacterial. But so I want you to think that way when you're taking the HESI, you know? And that's why I say med surge basis, because all of your HESIs are med surge based, because that's the basis of all our healthcare, right? All right, where is the game from group number one? Well, room number one, whatever.
You gotta give us just a second. We're trying to figure out how to share these.
Okay, well, you can share it with me if you want me to share it.
Do I just need to put the link in the chat? Because I don't know how to. My MacBook is not letting me share my screen.
All right, what about one of your other group members? You can put it in the chat. I'll try to pull it up, but I don't know that it's going to work. So one of your other group members should be ready to present with something. All right, you guys did a Jeopardy?
Yeah, we never did. We weren't able to get the Kahoot to work, so we
All
did.
right, so here's your Jeopardy. How many teams you want?
Everybody can just work together, can't they? We could do no team.
All right, we can do no teams. Ready? Here we go. We don't have any categories, but we have 3 rows. Pick a number in a category, anybody not on this group.
First row 100.
Hey, you guys read the question.
The nurse is performing fetal heart rate monitoring on a client who is 39 weeks along and has been in labor for 14 hours. Which of the following findings is the most concerning?
All right, so before I even look at my answers, I should have it in my head. But go for it. What is most concerning? Somebody answer.
Late decels.
Late
Good. Late
decels.
decels are always a problem. I don't care how many hours she's been in labor. I don't care what's going on. Go ahead. So what's your answer? Hit the space bar. Hit the space bar.
I think you shared it.
Good. Late deceleration. Sorry, I did it. All right. What are we up to next? Somebody pick.
500. Any
First column,
category.
second, third.
Anyone.
All right, we'll pick the middle. Fetal heart with moderate variability. What do we think about that? Is it normal? Is it early? Is it tachycardia? Or is it variables?
Fetal tachycardia.
Yeah, it's high heart rate. We don't know if it's variables because we don't know what it looks like. What's our normal fetal heart rate?
110 to 160.
Yep. It's gonna be a little fast. So we're gonna have fetal tachycardia. Very good. Okay. Next one.
Let's do the N category for 300.
What is the full length of a full-term pregnancy?
C.
C.
Is the answer?
Yes.
C is the answer. A is a pretermer, B is a pretermer, and D is a way post-term, and we do not want a 45 weeker. That baby probably won't be kicking much. All righty.
Last category for 500.
What is our other word for high pressure in pregnancy?
C.
Preeclampsia.
Good job. Preeclampsia. All right. What else we got here? Somebody pick one.
Middle 400.
Middle 300. Severe back pain with OP. That's the way the head is positioned, right? Occiput posterior. What are we gonna do?
Apply counter pressure.
Anybody else have an answer?
Trendelenburg.
A.
Yeah, you're never gonna put pressure. Oh, well, they put counter pressure. Explain this answer for me, please. Counter pressure where?
I would
Yes.
think on the lower back, because isn't that where she's probably feeling pain? So like to help relieve pain.
Well, the problem with this answer is that I wonder where you're putting the pressure, because remember, we never ever put uterine pressure on there, and that's not going to do anything to the head anyway, because the
Oh
head's
no,
all
I
the way
thought of it
down.
as like pressure on the back
Okay.
to
All right.
relieve
So if you're going
pain.
to put pressure on the back, that will help with the pain. That's not going to
Mm-hmm.
help with the position of the head, you know? So that's an interesting question, but no one's answering, so we'll move on. All right, go.
500 first column.
The nurse is caring for a client in labor, which assessment finds that they're beginning the second stage of labor. This is very only one answer here.
Cervix is dilated.
Anybody want to dispute her?
A.
Completely dilated.
All right, everybody thinks completely dilated, and you are right. That is our second stage of labor when you're completely dilated. There is no question about it there. Membranes have ruptured, contractions regular, who cares? And this just means expels clear fluid. That means that their water broke. So we know that's not second stage. Okie doke. Go for it. Anybody?
First category 300.
All right, nurse is in a delivery room. After the nurse prevents heat loss by doing what?
Drying the infant.
Yeah, we do all these actually to prevent heat loss. We make sure that the warmer where the baby comes out is warm. We don't have to, well, we close the doors. We dry the infant with a warm blanket and we have a warmer over the crib. I don't know what the answer is here. Yep, with a warm blanket. Okay. All right. Let's do 100. During which trimester does most fetal organ development occur?
B.
Isn't the second trimester?
We got one for second. Anybody for first? Anybody for third? Yep, this is the problem sometimes. First trimester is when a lot of the growth is occurring. Think about your folic acid, right? With those spines that are open, spina bifida. Because a lot of people don't even know they're pregnant for the first trimester. How much is the first trimester? That's weeks 1 through 12. A lot of people don't even know they're pregnant at the time. So this can cause a lot of problems because if you don't take the proper, if you don't plan and it's accidental or not planned, then during your first trimester is when everything's developing and there's problems then there, right? All right. What else do we want?
First row, 200.
Which one? Left, right, middle?
The first row.
Nurse is preparing a fundal assessment on a postpartum client. What do we ask them to do first?
Urinate.
What do we do first?
Urinate first.
Well, we could, but when we're doing the assessment, sorry, I misread it. The initial nursing action in performing this assessment, what are we going to do? What did Keyshawn tell us is always the answer? Massage
Massage.
the fundus. Oh, so I misread it the second time. Why do we have to have them urinate? If the bladder's full, what's that do to the uterus?
It kind of pushes it up.
Pushes it up, pushes it over, right? Because it's full. It's like a balloon. Shoot, shoot. All right, good question there. Go for it.
400, first row.
The nurse is monitoring a client in active stage of labor. Client has been experiencing contractions that are short, irregular, and weak. The nurse documents that the labor is experiencing which type of labor dystocia? Oops.
Hypotonic.
Why did you guess hypotonic? I'm guessing you're guessing here. Why did you guess that?
Because it's in hypotonic labor when it's like weak, short, irregular.
So what you think about with hypo and hyper, this is where your English skills come in, honestly. A lot of these are going to be like, precursors. Hypo is like a hippopotamus. Hypo, it's slow. Hyper is fast,
Wow.
right? So if you ever see hypo, it's something slow, like hypotension, low blood pressure. Hypertension, high and active and moving a lot, right? Hypothyroidism, hyperthyroidism. Think about all these words that have the word hypo and hyper. So remember that, okay? And we know that it's going to be slow, so it's not preterm labor. I will tell you that's not the correct answer, but that's okay. The correct answer is hypotonic. It's slow. What would preterm labor be? What would preterm labor be? Labor before what?
37 weeks.
Yeah. That's preterm labor. That doesn't have anything to do with the contractions. It's when it happens, not what happens. Okay, go.
Second row, 400.
Client is 7 centimeters and requests pain relief. Best option?
Epidural.
Okay, why are we not going to do a IV bolus?
Because it's already past the time.
Yes, and because if you give an IV opioid bolus, what are you going to do to that baby?
The baby can get
Fetal
drowsy and sleepy and
respiratory dysfunction. Yeah.
Very good.
Yeah.
Baby's going to get sleepy and tired and come out crappy. That's what it's called, crappy. Spinal we do for what?
C-section.
Spinal. Good, C-section. When do we give general anesthesia? We really try not to. If it's emergent, we do it. When else? If they have to, due to something like in their, their makeup, like the way their body's made up and stuff like that. Okay. All right. Should we do 400?
Yeah.
What's the purpose of an ultrasound?
C. Confirmed fetal heartbeat and gestational age.
And that's the first thing that you'll do after 6 weeks. You'll be able to see a fetal heart. Okay. And, oh, I didn't answer that, sorry. Good. Okay, we've got 3 more. Go for it. 200? Late D cells, what do we do with for late D cells?
B.
Reposition.
Yep, you always put them on the left side. Why? Why do we put a patient on the left side? What does that allow?
Opening of the lungs.
No. Well, good guess. What's going to the left do? What does that take pressure off of?
The heart.
The vena cava, right? That goes
Yeah.
whoop down your back. You go on the side. Left side always is going to give you the best, oopsie, the best option. Okay, what else? Can we do 100? Contracting every 3 minutes, 60 seconds, and 6 centimeters dilated. That's our key there. What stage is she in? Oh, well. Okay. What stage and phase is this? All right, we know it's not the one we just answered, but I'm gonna see what
Active.
how they put.
No?
This is not a correct question, so we're not even gonna go
Is
over
it
that.
active?
Yeah, it would be active. Which vitamin is most important for neural tube defects? I just talked about this to you guys.
Folic acid.
Yep,
Oh,
folic
yeah.
acid.
Yeah,
They-
folic acid.
They need it early on. They need it early on because remember that neural tube is developing. So they need that. Vitamin K is something we give postpartum for what? To the babies. What do we give the shot of vitamin K for?
The
Blood
hemorrhage.
coagulation.
Yeah. All right, so that's our Jeopardy. Okay, we are at, what time is it? 7:30. I have a review we could do, but you guys are really quiet tonight, so I'm not sure I'm gonna do that. Are there any last minute questions for HESI? No, you guys are prepared to take it. Everybody has signed up.
The topic list that you sent out is that like topic list that's been seen last year on previous tests.
Yes, the one that's on the announcements.
And everything like recordings are going to be readily available, well, are still readily available for us to go back and watch.
And they are under your announcements. We've already had a few. And I'll
Okay.
post ours, but ours was just your games, which is what I wanted anyway. What else can I tell you? Oh, the week after HESI, I have to meet with each one of you. We can meet at a 30-minute spot, or I can let you guys schedule time with me. What would you prefer? Raise your hand if you want to do a 30-minute spot. Don't be shy. 1, 2, 3, 4, 5.
You said for the last week.
Yep, the last week, because our if we can't, you guys have to meet with me after HESI or you will be marked absent.
It
More
depends the
absent,
day
but they said
too
we
because
got
we
a
have
break
class.
from the 20th through the 28th. They sent out the email.
That is not correct.
It depends the day too because we also have class in person.
Yeah. So obviously we're not meeting on Christmas Eve, right? Me nor you are going to be here on Christmas Eve.
Right.
So what it says is, okay, well, I mean, it can say whatever it says, but that's not what us as professors are being told. So you guys have to meet with us the last week after HESI's. So we can either decide on a day or you're going to have to meet with me. Either you take your HESI whenever you take your HESI and I get the score back and I get your, what do you call it back? Your remediation
Mediation.
done. Mm-hmm.
Okay, so the 17, 16, I think we take it on the 16th. We had to come back and meet with you like the 20 something, the 22nd, 23rd, 20, not the 24th.
Dr. Brown proposed, and I am happy to do this if you guys want it, but like I said at the beginning, I'm leaving this up to you. She proposed Monday the 22nd at 6:30 or whatever time our class starts, 5:30. That's up to you guys. If you want to meet at that 30-minute increment, then everybody can do that. She planned that for everybody got a schedule for that week as to when their classes should meet. If you don't want to do that, then
What are the other options? Because I already have to work. I didn't know that we were gonna have to do it like this.
yeah, so this is every nursing class. And I
Mhm.
know you guys have taken them before. So you're always gonna have a class after HESI, just so you know.
No, I took one before, but the class after, it was already communicated. Like I had already took off, but I didn't know it was like we were gonna have to meet on that specific
Yeah,
day.
no, I understand it's confusing because of Christmas.
Yeah.
I'm not upset with that at all, but I'm just telling you, like just for information purposes, you guys are always gonna have to meet the week after HESI.
So
Our
when
remediation couldn't count as our attendance.
No, it does not.
so when you say Monday, are we saying like we all get on here on Monday like this? Hmm, okay. And will we stay on for the entirety of class?
30 minutes.
Okay. Are
It looks like everybody's saying Monday is fine. If Monday is a problem, then I'll discuss that with you later, but everybody is saying Monday's fine. Let's plan for December 22nd at 3:30 for attendance purposes only. We'll touch base. Don't worry, it's going to be the probably easiest class you'll have in all of nursing school. We'll
Okay.
meet, we'll say hi, what's up, and call it a day. Okay? It is for attendance purposes. I understand it seems juvenile, but the thing is, I will also touch base with every single student during that 30-minute period. We will have a one-to-one in a breakout room. Okay? Any questions? Okay, best of luck to you on HESI. I think you guys will be prepared. Kind of hard to tell because you guys are so quiet, but I think you guys know the content. So do your very best. I put out the remediation dates and need, right? So you guys know what you got to get. I opened up HESI for you guys on the grade book. So if you want to figure out what you have to get in order to pass, remember 78 to pass, but then assignments come in after. So even if you're passing, if your assignments are like you haven't done assignments, you have the potential to fail on assignments. Okay?
Could you put the assignments, the homeworks to see more or less?
No, I really can't turn those on. We're not allowed to turn those on until the end of the quarter. But if you have some inkling to think you haven't done assignments, my suggestion is do them. Because those assignments, although they're at least 20% of your grade, you know? All right. Any other last minute questions?
Can
All
you
right.
start
So we'll,
after like 2 minutes, 1 minute?
yeah, sure.
All right.
So we will meet on the 22nd, 3:30 p.m. If you're not there, you'll be absent. but you know, it's the end of the quarter, so call it a day.
That's
It's been a
5:30
pleasure
our
having you
time,
guys. You
right?
guys are very quiet. Sorry, 3:30 your time, yeah. Eastern time.
5:30.
Yeah. Oh, yeah. 5:30 Eastern time.
All right, sounds good.
All right.
You
Good night.
know,
I need to meet with you after class as well, Miss
Okay.
Arani.